So it's a pleasure to have with us today economist Bryan Caplan from George Mason University, and author of two of my favorite books, The Case Against Education and more recently, Open Borders. There's other books as well, but I've just mentioned those being two that I really enjoy, Bryan. So welcome and thanks for joining us.
Thanks very much for having me, Carlos.
So with all of these conversations, I'm starting by asking the question of, let's get ourselves back to March and trying to understand from your perspective, when did you notice, or if you thought that this was a big deal, and how would you, what was the information and models or what was in front of you that convinced you that, okay, this is serious, this is going to be bad, how bad is going to be, and sort of talk through a little bit how you thought about the policies being put in front of us in the very beginning.
Let's see. So, I mean, I had been very vaguely paying attention to news in January and February, but I honestly did figure it would end up being something like Ebola or SARS, where it's limited to one small area of the world and otherwise would have no important effect on me personally anyway. And then I would say, honestly, I started getting just a little bit nervous when I was traveling to Latin America in February, and I just noticed a lot of people working in the airport in masks. I was like, I've never seen that before. But again, I think that I probably still shrugged it off and said, well, people are crazy, right? Which I still believe, but they're not crazy all the time. And then I guess when I got back, I talked to a few people whose judgment I trust a lot on matters like this, especially my colleague Robin Hansen across the hall. And he was saying how, even though he agreed that usually predicted disasters do not really transpire, he said this one was different. And I did start paying attention then. And then I really did see, and especially in, of course, the social reaction, which happened much sooner than any significant number of actual deaths or sickness. But just when schools started closing and trips started being canceled, and I think actually I was really shocked when Disneyland closed. I'm from Los Angeles, like Disneyland closed, closed Disneyland. So these were the things that got me paying attention to the numbers. And then once I started paying attention to the numbers, I would say that I stopped paying attention to most of the other things, which I knew were just anecdotal experiences and don't prove much of anything. But did start looking at the numbers and saw how the number of cases and the deaths started rising in a way that was very similar to what people who were, I would say, like the moderate pessimists predicted. The extreme pessimists predicting millions of deaths, they still seem crazy to me. And again, and of course, if they had said it'll happen unless we do the following things, then it may be different. But I think that many of the pessimists were just saying this is going to happen. So, and those people, I would say, have been shown to be wrong. So I guess that's how most of my thinking in the early phases went anyway.
So when you're thinking then in the early phases, when you start seeing things like voluntary choices by people, like just closing Disneyland or the NBA deciding, that was something that struck me as like, whoa, the NBA is going to stop. Okay, that's going to be hard. And I was teaching at the time a class in Chicago, and we couldn't fly anymore, and that was something that was very surprising to me. Not surprising, but it was definitely hit it home, right? That okay, this is happening. But those are all voluntary choices. Yeah. In terms of policies being put in place, how were you thinking about the choices that were, that were given to us? We were given this choice of this seemed to be like a dichotomy of extremes, and how would you, what were your reaction to those at first as an economist?
I would say that I don't think there really was a dichotomy. It was more of a near unanimity if we have to go and do something very extreme. And honestly, we really have to go and emulate communist China, which, what almost every country on earth has done is not normal, right? Or at least it wasn't normal until communist China made it normal. And if you know anything about the history of communist China, I would never consider it a country to emulate really in almost any way. So in terms of the extremism of the reaction, that's something that I did notice, and that bothered me very much. Just the way that people wanted to just shut everything down without really indiscriminately, without distinctions between, well, what are high risk and low risk activities? What are ways that you can mitigate the risk? So again, to me, like as an economist, I'm always thinking not, is it safe? There's nothing really safe ever, right? You can be hit by a bus just walking down the street. So it's really, what are the odds? What are the actual risks? And actually one of the earliest things that I was doing was actually trying to look into infection mortality rates and notice, there's a big difference between case mortality rates, which is just number of people who died compared to the number of people that have tested positive, versus infection mortality, when you actually know that someone's sick, what are the odds that they die? And especially realizing that there's enormous selection bias because the people that get measured are generally the really worst cases. So, I was very concerned there. And it took me, very quickly, I did see this point that the infection mortality rate varied tremendously by age, which then very immediately led me to think, well, shouldn't it be that young people keep living normally, more or less, and old people then isolate, and rather than having everybody isolate? So that was my immediate reaction. And then when I learned more about how important underlying conditions are, and it even doesn't seem so much that age per se is the key issue, other than older people with more underlying conditions. But once I realized that, it's even clearer. Now it should be the people that have underlying conditions, who generally will be old, though not always, who should be very careful. And again, other people should live a basically normal life, both because it's very costly to ask people and bridges their freedom, but then also the point of having healthy people catch it does move us closer to what we call herd immunity. As to how far you have to go in order to get there, it's a complicated question, but what I say is, it's a continuous variable. So, if you have, there's less infection when 20% of the population is immune than when 0%. So just saying, well, look, if we can just move along that dimension, basically getting healthy people sick and then having them recover has a very similar effect to getting more people to wear masks.
Or more people vaccinated. That's the same, is the idea of that's an effective way to get a vaccine, right?
Yeah. Yes. Right. And I guess, also, along the way, my colleague, Robin Hansen, again, he was looking into
variolation.
Something called variolation, basically just giving people low doses, which is very similar to a vaccine, right? And people got very upset at him, of course, as they almost always do whenever he makes an original point, good or bad, right? But usually good in my view. So yeah.
So one of the professions that I've been particularly disappointed with throughout this was economists, and the reason for it is because economists are always very, very, very careful, at least tend to be very careful in thinking about the sort of unintended consequences of doing something. And in this one, we're yes, very quickly I think became available the data that yes, the older and people with pre-existing conditions are the most vulnerable. Most of us are not. Most of us are not going to die of this. And if anything, the risk is actually very comparable to other respiratory infections that we face routinely, right? So that
or even if it's 5 times, it's still
even if it's 5 times, it's so low, right?
It's 5 flus.
Right, exactly. I can get a year of 5 flus, and chances are I'm not going to die, right? But then we're looking at this thing where okay, the policies are put in place, the policy being proposed and implemented, and I feel that the majority of the profession was like, oh yeah, no, that seems to make sense, without really focusing or hammering on the underlying, the sort of the consequences and the things, the costs really that we're going to bear associated with this. There are few voices that were very loud on this, but I would describe them very, few. They're not the mainstream voices, and voices that were, are still being deemed lockdown skeptics or something like that, right? Anti-scientists in some ways. Do you have the similar impression on the profession?
Yes. So I guess that my opinion of my fellow economists peaked around 2007 and has been going downward ever since. So I guess I was not surprised. I mean, ultimately, I've long known that the typical economist is a normal human being first and an economist second or third or fourth. And there's also been two big moves in the last 20 years in economics. So one is that there's been a move in a more left-wing direction. Again, economics was always left-wing overall, but the balance used to be something like 3-2 for Democrat-Republican ratio. So it was one where, even though the left-wing view was predominant, still it was a very mild predominance, and there was just a lot more room for other views. And over time, especially with the next generation of economists, it's been replaced with a very heavily left-wing demographic. So there's that. And the other thing is that as the focus of economics has moved towards doing empirical work and just focusing very heavily on getting proper causal identification in your paper, there has just been a great forgetting of the fundamental tools of economics, like cost-benefit analysis and expected value, and just the idea that economics is primarily a grammar of thinking. It's a way that you organize your thoughts. Again, this is not lost entirely, but the share of economists that when they hear they have to take a precaution in order to achieve a benefit, who now say, well, wait, how good, what is the actual size of the benefit? What is the, how much does it reduce the risk? How much is the gain? I think that has diminished considerably from where it would have been in 70s or 80s or even 90s. And so I think that's another thing. But I mean, there I already did realize how things had gotten worse, and it's very disappointing. But unfortunately, there's not too much I can do about it other than to say that we used to know better. We used to have a better way, and also, like, why aren't you teaching your students the right way to think? Why aren't you teaching them economic thinking? And yes, I know that it's hard to teach people how to think, but good God, try.
At least we need to try. Right, exactly. I think you're right here. I think it was in maybe June 1st. I'm going to quote you here for a second. That you accept a strong presumption in favor of human liberty. You cannot rightfully shut businesses and order people to stay at home out of an abundance of caution. Instead, the burden of the advocates of these policies to demonstrate that their benefits drastically exceed their costs by at least 5 to 1. And nobody did that. Nobody even tried to talk about that, right? I mean, that's to me so clear with the point that, I shouldn't be here as an interviewer telling what I believe, but that's what frustrated me the most. Like, without any indication of the trade-offs we're facing, these decisions, as draconian as they come, right? This has been as extreme as they come.
Yeah. So, again, that sounds quite right to me. Let's see, what was I thinking about all of that? Oh, yes. So here's the thing. I mean, I think most people would hear those words that I wrote and say, well, this is just, dogmatic libertarian who says he's only going to go and support these violations of principles if you get over a near insurmountable barrier. And what I would say is actually this test that I'm talking about is one that most people use actually for anything they take seriously. So if someone came out with a cost-benefit analysis saying that banning Satanism would just pass a cost-benefit test by 5%, I think almost no one who ever cared about free speech would say, all right, fine, let's round up the Satanists now. Instead, they say, look, that's not enough. It's one thing if we got to round them up to go and prevent these a series of massive satanic attacks or something. But otherwise, even if, yes, it turns out that every Satanist really messes up their family and their parents are miserable and it causes suicides because people can't handle the fact that their kids become a Satanist. Even so, you really got to show an enormous benefit of bending this principle. And I think that applies to almost any principle that anyone really cares about. So to me, the idea that you wouldn't care about the principle of don't go and tell people they can't leave their homes, right? That seems at least as important as the freedom to practice Satanism.
And do you share the view that I think a lot of people defend those policies still on, there was at a moment in time where we didn't know enough about it. There was so much uncertainty. The unknowns were too large. And there was a fear of looking what was happening in Northern Italy, perhaps what was about to happen in New York City, of our inability to process the cases. So like a shutdown, let's say of 2 weeks, was something that would lead at least to an avoidance of the hospitals being overwhelmed and with the flatten the curve idea, right? So that was I think the way those policies were advocated. This is a temporary thing to just flatten the curve. Your reaction to that?
Again, of course, I'd say that doing it for 2 weeks is a lot less unjustifiable than doing it for months. Yeah, but even there, I would say, so this is the same reasoning as round up all the Japanese after December 7th, because look, they're probably fine, but let's have an abundance of caution. Round them all up. How do we know there isn't at least one terrorist cell among the Japanese? And I would say, all right, yes, I understand that point. And yes, things are confusing right now, but that's not good enough. And if you think that things like that are good enough, then really you are going to be doing one terrible thing after another, right? And ultimately it comes down to the terrible things that are popular will happen, and the terrible things that are unpopular probably won't. But really bad things can be popular. It's what I like to call the hysteria and herding of the population. It really does move around quite dramatically in response to crazy events. So this reaction could have been much stronger after 9/11, for example. So, and I do actually remember after 9/11, some people saying, well, this is actually, I don't even think it was even a joke, saying, look, we don't really know which country's behind this. Let's just attack a bunch of Middle Eastern countries, right? And it's out of an abundance of caution, let's just invade a bunch of places.
Right.
All right, so you do realize the horrible things that you're talking about here, and like it seems to me like that's not sufficient, but or even close to go and justify this kind of thing.
What I would say in the even the reaction of 9/11, right? There was a we didn't face dictatorial powers doing those things to our lives. It was something that you had a president reacted very strongly to it, and all of it got voted by Congress. And you might disagree with the way that our representatives decided to do something, but it got voted by a legislative body where we've been living through a system where we have 50 despots plus one.
Yeah.
And what's really funny is that there's a lot of people like arguing that the one despot should have been more strong throughout the whole thing. It's like,
Sure.
really, that one? You want to give more power to the one despot?
I mean, so my dad is is always inclined to blame China for anything wrong in the world, and in this case, he really wanted to blame them for the entire pandemic, right? And again, the question in my mind is, so what is it you wanted them to do? So like I think you heard stories about how they suppressed it for the news for a couple of weeks. Of course, the they is so like it was not clear that it was like the very highest level, like you got local people suppressing it. But in any case, given that most countries didn't do very much during that time, I suppose your model could be that the other countries will react 8 weeks after the Chinese officially react, but it's not clear why that would be your model rather than they react 4 weeks after it's clear that it's a serious problem, something like that, in which case I don't see that China delayed anything. But again, thinking about the way that my dad would reacted if China had done something drastic, like foreigners can't leave Wuhan either. We don't break the quarantine just because you're not a citizen. Everyone has to stay here. I mean, again, that's the kind of thing that I think would have been a major international incident, and yet that out of all the things that China could have done, I think that is
helpful.
Yeah, that's the one thing I think that actually could have really tipped the balance if they just said no one gets out until the quarantine is over. I mean, the amount of international blowback that would have caused, I think, would have been enormous. I mean, I doubt that would have caused World War III, but I would have been still like pulling my collar, like 2% chance of World War III over this if China just said, like no way, we're doing it our way, tough luck. Right.
Let me pick up on this point, because this point is a point of I think that a lot of people that even was okay with the extension of the lockdowns as we had in the country. It's like, we say, well, if China could have not mitigated this, but really suppressed the virus, right? If they had locked down Wuhan somehow, there is a state of the world where this could be suppressed there. Mm-hmm. And I think that there's a lot that we're learning now, even places that did that. It seems that it's almost like a losing battle. It doesn't seem to be possible. Australia is seeing like a huge ramp up in cases now after what effectively an island was able to keep it under control and suppress it. So and that's the part that I at least, I think there was a big shift in the goalposts of we're trying to flatten the curve to now let's try to keep it shut to mitigate, to suppress this, end the virus. And, cold viruses are really hard to suppress. They just apparently are incredibly resilient, and they're going to be around us. And that's why I think it's to me very frustrating to be looking at the recurrent asks for lockdowns as just like, what are you trying to accomplish at this point? Aren't you just pushing those infections to the future? And perhaps maybe you're just hoping that a vaccine shows up first. How do you think that sort of the idea out there?
Right. So, I mean, the view that delaying actually has saved a lot of lives just because even though we don't have a vaccine, we've got better antivirals and better treatment. That may be true. So, I mean, I tried looking into it and it didn't seem clearly wrong. But on the other hand, the people that were really optimistic, they and told me things are great. Like it wasn't clear that their claims were checking out either. So, again, I really am not too clear on that. In terms of whether it just can be like completely cut it, like whether we actually could just get rid of it. So there again, it seems like there's some countries they managed to get it down to such a small fraction of where it was that it does seem at least plausible that they could drive it into extinction, but at least with it for a country. But then there's the question of what do you do about relations with the rest of the world? So again, this is something where I am not super confident, but it seemed to me that Germany got the number of cases down really low. And then, at least supposedly, their contract tracing teams were, so good, where they actually, and they had enough of them relative to the problem that a lot of times they don't have anything to do anymore, right? So if you could actually have something like that, it's fairly modest cost to be able to go and just hold things down, especially given that Germany still is open to all these other European countries. that's pretty striking that anyone's able to do it. So I guess, like what I've said recently is, if
They
you're not
closed their
confused,
borders, though. No?
but I don't think but the borders are not still closed as far
No,
as I'm
they're
aware.
open now. Yeah, yeah, and they actually are they are suffering from cases coming from Spain apparently, and they're struggling a bit with that. Right.
Right. But I mean, one of my main thoughts is, like, if you're not confused, you just don't understand what's going on. So I said, like, I wouldn't be surprised when 3 months every country managed to get it down to the same level that Germany's got it in. I wouldn't be surprised when 3 months every country is doing as badly as the United States or Brazil. And I'm just honestly, I'm just pretty confused with this situation. And, like, I noticed that people who pontificate almost never have any concrete prediction. They almost never say anything that can be definitely shown to be right or wrong, much less put some money on it and stake their reputation on the line. So, I mean, I think honestly, the amount of respect that I give, even for people who say professionally they're doing it, but fine, you're professionals, so you know more than other people do. So say something specific. Give me a number, give me a date, right, and put some money on it, and stake your reputation. This is what's going to happen. Right? To me, when someone says I'm an expert, but I'm just going to go and speak in platitudes.
Well, the experts have said it, and they've used numbers. They're like they've been. I mean, either it's coming or they were absolutely wrong, right? 2.2 million people are going to die in the U.S. They said it by a date. They even said by July, 2.2 million people in the U.S. are going to die.
Normally, when they say that, if you actually pay attention, they have a bunch of qualifying words. Could die.
Good.
2.2 million could die.
What I like about that one is that
prediction: 2.2 million could die. It's like, okay, yeah, like I completely agree. 2.2 million could die, right? Or they'll have, like, unless we go and take drastic measures, 2.2 million will die, right? So normally, when people that are in the public eye have an instinct to avoid saying anything that can ever be demonstrably shown to be wrong. Which is a big point of Phil Tetlock's fantastic book, Super Forecasting, where you realize, look, anyone who does that, they do not deserve your time. They don't deserve your attention. They don't deserve your respect. Real people don't say what could happen. They say what will happen. They give you a date, they give you numbers, and also they give you probabilities, and they give you money if they're wrong, too.
Well, but that's the issue, right? Those people went in, and even making those statements, they convinced a lot of our governments to do radical things. They're convincing our governments to not open schools for the rest of the year.
Yeah. Now, as far as I know, I don't know of any, maybe I missed it, but I don't know of any state legislature in the U.S. that has tried to take back powers from governors. So, is there any legislature?
There is one. So the I think there was not a legislator, but it was a court. So the Wisconsin.
No, court's different. Courts.
But that's because of a legislative act, right?
Trying to say, where they were even trying to push forward a measure saying the governor has become a dictator and you can't do this stuff without our permission and we don't give permission.
But it was actually very interesting. I don't think people paid enough attention to this. Is that the legislator in Wisconsin has what they call the emergency powers of the governor have to be justified on a rulemaking basis. So they actually have an administrative law procedure to justify the existence of those powers. So they can give you for 2 weeks, but then after that, you have to go and do some justification for their emergency powers. And it turns out that the data available here was not enough to pass the bar of what we call, so then the court said, you cannot continue this unless you go through the rulemaking process. The government gave up. So I was like, oh, I can't do it. Because, I don't, this is made up. I don't have, this is like, a bad flu. I shouldn't say that because I get in real trouble when I say that. But that's essentially what gave stopped the governor of Wisconsin to continue the emergency powers that he had in place. So all right, so let's fast forward to now. Like how do we read? In fact, I should go back a little bit. You wrote something a while ago talking about what you were doing. So again, putting your money on where your mouth is here. So how did you handle personally some of the stuff lately? You wrote about it and you told why you're doing it, and you're surprised by the fact that a lot of smart people that were not acting in that way.
Right.
So tell us a little bit, how did you interpret the evidence and how did you act upon that evidence?
Yes, I say, there's the meta point of the way you think about things, and then there's the actual concrete behavior. So what really surprises me is when smart people don't think in terms of probabilities. So when smart people just say, look, scientists have found there's a risk of walking through a room that a sick person breathed in. Say, okay, I'd be amazed if they didn't find that there was a risk, but how big is that risk, right? And so is there any actual, is there evidence that at this dosage, that this is actually that this ever gets people sick? What are the odds that it gets people sick? right? So that's the kind of thing that really surprised me when smart people were, like smart people, especially people that are that normally have quantitative ability, just started talking like normal people, right? And the
We
kind
have
of
a
thing,
duty. We have a duty, right?
the thing where they say like any risk is too high, or again just like just saying there is a risk, like this is or like using hyperbolic language, this is too dangerous, or just imagine what would happen if someone that you knew died, right? And again, like these are all the kinds of questions where I would say quantitative people need to be trained to say those are terrible questions to ask. They are ones that make people that confuse people and prevent them from thinking clearly, because everything you do can lead to your death and the deaths of other people around you. So it's a question of what are the actual odds that you should be focused on. And if you're not interested in those odds, then I would just say it's very hard to take anything that you say seriously. So I mean, that's sort of the meta point of the number of people that were just not thinking in a quantitative way. And then in terms of these civics, so see, like on the civics, I can much more understand. So like if I had a friend who said, no, I'm still pretty worried, and here are my reasons why, or I still think this is a prudent measure, and they went through the math, that then I think we could still have a very good conversation. But what I basically wind up doing is trying to find the most up-to-date numbers on infection mortality rate by age, by health status, and then figuring out how that compares for me to things that I already do routinely, like driving a car, right? And again, by my math, my COVID risk is probably like basically. And then of course the other thing is, even if you try to stay very safe, you can still get it. And of course, even if you start living in a more relaxed way, you very likely will never get it.
Right.
So I say, all right, so let's ballpark. So suppose that changing my behavior to live in like a 90% normal way would move my infection rate or my infection probability from 15 to 40%. So then you're talking about something like, I think like a year's worth of driving risk, which to me is not bad, right? And especially realizing that when I'm driving, I'm often risking the lives of all my children, right? Who actually I would, honestly, I'd rather that I died than one of them died. And they're all kids, so their risk is really low. So when we put it that way, so like in terms of the familial risk, I just don't see that this is very risky to my family. Now again, I'm not blind to the possibility of infecting someone that is higher risk. And what I say is, there's a lot of common sense measures that you can take there. Most obviously, just avoiding contact with people that are high risk. Or if you know they're high risk, then saying, well, we should probably avoid contact. Or of course, there's also asking, so like, are you high risk? And like, I'm happy to go and accommodate you in ways that seem reasonable to you, right? So those are all ways that I would handle and have handled these things. And at the same time, saying, look, if you're very high risk, then it is reasonable to say that you should be the one that's taking extra precaution, and there's no reason to be resentful of that. Compared to other people. So you'd say, yes, if everybody would if the world would just revolve around me, I could live my life and everyone else would stay inside. So yes, well, that's not a reasonable expectation to put upon strangers. You ask for moderate things. So, I've said, if I see someone wearing a mask, then I try to stay further away from them, because I take that as a sign that they're worried, right? So I don't want to upset anyone or make anyone nervous. On the other hand, I'm not going to go and wear a mask outside to take a hike just because someone is terrified of seeing me 100 feet away.
Right, or because a governor told you to do so, right?
Yes. They're honestly, everyone breaks laws every day. Right? That might have actually stopped during the quarantine because people are inside. So maybe they're not breaking laws every day, but anytime you're actually moving around, interacting with other people, you're always breaking laws. You are always breaking the law when you're driving, practically. I've never met a human being who actually follows traffic laws in any scrupulous way, because the laws are unreasonable and ridiculous. And really, they are there so the police can go and hassle people whenever they want to for other reasons, rather than to actually go and enforce the law per se. So so my view is, when laws are stupid, people already break them routinely, and honestly, I don't see anything wrong with this, and I do it too, and I'm happy to do it.
So a point that I think escaped a lot of even economists writing about this is something you mentioned that well, you're going out, you're doing, you understand the risk that you face, and I just you mentioned a year worth of driving, and probably driving is the most dangerous thing that you do on a routine basis. Mm-hmm. So it's not trivial that you're adding that, right? But again, you start from such a low level. And I would say that the latest calculations that I've been looking at, I think is one way to look at a COVID risk for people in our age bracket without conditions is something like adding somewhere between 2 or 20 days in a year. So just
So
like your
that's
normal
way,
life, they use a little longer.
It's true. That's way below what I calculated about 6 weeks ago.
Right, right.
But
It,
I mean, like if you send it to me, I'm very curious. I'd like, so.
No, I'll find the reference.
I'd like to know
That's
whether
based on British numbers, so maybe we need to be a little careful with that. But the point that I was trying to make is
British numbers sound pretty good to me, actually.
They are. That's right.
I mean, if I had to either generalize about my own risk from New York City or the entire country of Britain, I think I'd rather do
Britain, right? Yeah, that's right. That's right. But the point that I was going to make about one of the issues that people say, well, but you making your own choice is creating externality. That's like a thing that we like to talk about in economics. And externality is that by you going out, you might increase the transmission of the virus, and therefore another vulnerable person might get it and die. More people will die as a result of your choices of going out, right? You're not bearing the cost of that. But I think that's not necessarily the whole way to think about this, because as we talked about earlier, people like you and me getting infected is actually perhaps a positive externality.
Yeah, sure.
And that has been sort of completely lost in the discussion of this.
Positive if you can do it responsibly.
Exactly, positive and responsibly.
Then you isolate. So which again is just what I would do. I mean, I remember like even in March, I asked my wife, all right, so what is our plan if one of us gets sick? What are we doing? Right, and that's actually where a lot of the stuff on dose response function was relevant to me, because okay, what we don't want to do is put a bunch of sick kids together in a small room. So if one of them gets sick, like each person should be spread out in the house as much as possible, open up the windows, and that way you don't wind up getting a really high dosage of it in the same place. But yeah, I mean, of course, like with any externality, of course, driving's an externality, and no sober person says you should never drive. Right. It's one thing to say, take precautions, look both ways, don't drive too fast. These are all things that prudent people do, and that I'm happy to do. Not just for my own safety, but the safety of other vulnerable people, pedestrians, and so on. But if someone said never drive because you could hurt someone, there's an externality, I say that's crazy. And again, you're ignoring the enormous cost that you're putting on me, right? And I would say the same thing with infections, saying yes, well, if it's a substantial benefit to others that I can give at a modest cost to myself, great. But if it's the other way around, then I don't think that is so great. I was actually doing some Twitter polls on when would you consider something murder? So, suppose that you're sick and you deliberately cough in somebody's face and they get sick and die. Is that murder? And yeah, probably it is, right? But how about if you have no symptoms, you stay 6 feet away from other people, and then someone happens to get sick as a result? Was that murder? And I'd say, that's I would say that's no more murder than if you accidentally kill someone riding on your bicycle, where you were doing very reasonable things, and yet once in a long while something really bad happens when you're behaving responsibly, but doesn't show that what you're doing is irresponsible. By the way, this is one of the great lessons that economists ought to teach their students more, which is that just because a bad thing happens doesn't mean you should change your level of precaution.
That's true.
Right. So look, I have a level of precaution. The level of precaution is designed to achieve a certain level of risk. The fact that the risk happens once doesn't show that you weren't cautious enough. And yet, of course, to non-economists, like there was a fire that showed that we need more fire precaution. It's what is the overall rate of fire? If it's 1 in a million, then maybe this is actually a totally acceptable one, and we shouldn't do anything. Right?
We'll call that ex post rationale versus ex ante, right? Right. So your ex ante decision making was the right one. Don't ex post evaluate it, because that's gonna be bad, right? So two things I want to talk about now, just moving a little bit to schools. That's something that we're having a big policy decision that's taking place right now, is whether or not to open schools. And your work has been and I want to quote you, I think again here, maybe not perfectly, but a lot of your work questioning the value of education. It's quoted a lot, focusing on high school and college, but I think you were more vocal about it, saying, no, I question all of it, all the whole. And by education, you don't mean teaching people stuff. You mean the way we currently teach people stuff. Our system.
When a politician says we need more money for education, that's what I think of as education.
Exactly. So, but now here we are, and somehow we're going to live in a world this fall where I can go out and do anything, literally anything in Texas, but my schools are going to be closed. Our kids are going to be like literally anything, not going to a bar. I think not going to a bar, but anything else. We can go to college. We can go to a football game in college. My little kid can go to daycare, but we cannot go to a school. To my K through 12 is closed.
Only public school or private schools closed
Well,
too?
there's a big fight going on currently. So local health authorities are issuing mandates saying that privates cannot open as well, nor charters. And that's a political battle of funding, right? You don't want people to get unenrolled from the public.
Yeah.
So the question is, I guess the question to you is that how do you look at this and you react to say, okay, well, I knew this is pointless. So who cares? Or are you particularly worried about, I mean, do you worry about the fact that somehow we're not going to have education in the country for perhaps the entire fall? How negative do you think of that impact is going to be?
In terms of student learning, I would be amazed if you saw any long run harm in terms of people's math or reading abilities. However, the point that I mostly talk about, high school, college, but I also occasionally mention younger grades. So whenever I talk about education, I always try to be fair. And I say, look, whatever else they do or fail to do, at least K through 8 delivers daycare. Or now I say, it used to. So even if they're not learning anything useful, you're just wasting their time making a bunch of stupid posters and singing songs that a lot of the kids don't even want to sing songs. Right? And I have seen plenty of miserable kids being forced to sing songs in schools. I mean, even if that's going on, say at least schools provide daycare where there's a place for kids to go and they can see other kids and someone watches them so their parents can go and do their job and relax, right? And now it turns out the schools are not even going to provide this one function where I've long said it's an undeniable service that they're providing. So yes, I say like if schools aren't even going to open, especially for K through 8, then they are totally worthless at this point. The idea that you're going to do online education for kindergartners is just absurd. Right? So the best case scenario is the parent has to sit there making the kindergartner do the work. So in which case it doesn't save the parent any time. They can't do their job. They can't relax. So why not just, at that point, you might as well just do homeschooling and save a lot of time and cut out the middleman. So yeah, it is just a case where the schools want to keep getting enormous amounts of tax dollars. And don't believe people say schools are underfunded. They get an enormous amount of money per student per year. So yeah, like national average years ago was already up to like 12,000 or so.
It's 15 now. It's 15 per student.
Yes. Up to this enormous level of spending per student on average. And what are they offering you? They're offering you something that's barely better than showing them YouTube videos. So
yeah, I think that's a thought process that now people are having.
Rip off. And yes, so people saying like give the parents back the money and then let them go and figure out what they want to do with their kids' education seems like a huge improvement to me. So I've been homeschooling my older kids for years, and of course never got a dime back from that. And originally my younger kids were going to have school open 2 days a week. And I'm like, all right, maybe that's not terrible, but it'll be better than nothing. But anyway, now it was announced in our area that there will be no in-person school whatsoever. So now I'm just going to be homeschooling my kids for at least the first quarter. So yeah, as to why I don't get that money back, right? Or of course you could go further and say, hey, maybe we should just give the taxpayers back their money, right? Who are not quite the same as the parents. Right. We've been ripping off taxpayers for all these years to give for these dubious services, and now we're not even giving you that. So why not just say, look, we don't. The rationale for us existing is gone. I mean, I have little doubt that if schools would just receive no money if they didn't reopen, I think then they'd be pushing to reopen. Which, by the way, I often heard economists saying things like, "Well, so you're worried about saving lives. What about people's livelihoods?" And whenever I hear this, I say, you have to remember, the people who want things shut down also want the level of redistribution to compensate for the loss to be so high that especially low-skilled workers are actually making more money now than they ever did. So they're not worried about their livelihoods very much. So there is a reason, I've heard people also say, well, it's not at all clear why the left is more supportive of lockdowns than the right. It could have gone the other way. And I'll say, yeah, it could have gone the other way in a system without redistribution. But once you have very high levels of not only redistribution in general, but especially extra emergency redistribution, then it all lines up ideologically because the left likes the idea of people getting paid to not have to do their job. They don't like the idea that you should have to have a job to get work. They don't appreciate the enjoyable consumer products that people mostly spend their time making. Most of what we do is not essential, right? And of course. Yeah, yes, well, it's not essential, but it is enjoyable, Why isn't that good enough?
Well, essential. I don't like the term at all. I think
Yes,
essential
yes.
is something that
Yeah,
I
well,
got to define,
you
right?
won't die.
Right. Exactly. I like to define what's essential for me, and
Yeah,
not letting somebody else
yeah.
do.
Immediately, like definitely the categorization of essential or non-essential was laughable.
Yes.
You know, like,
Yes.
liquor stores are essential.
Yes. Cannabis stores in places that cannabis actually, again, I'm completely support that, but it's like you're gonna have that be essential and not schools. Schools not essential. Um, so the it's an interesting point you make about like nowhere in the country you're gonna get the ability to in short period of time say, oh, we're gonna defund the schools if they're not open, right? But if parents were to unenroll, then they de facto get defunded, because I think most states the homeschooling sort of like basically the money goes back to the state coffers. They don't. It depends on the number of
Yeah.
students you have,
So
right?
I think that's the normal system. Of course, if schools are really hurting, I think the law would get changed.
Well, sure, but at least you put some pressure. And I'm
Yeah.
surprised that has not been at all anywhere a big campaign on this. I've talked to some people like, shouldn't you have some campaigns on like homeschool your kids? If the state's asking you to homeschool your kids, and let everybody be honest about it. But nowhere you see nowhere the fight
Yeah.
for that.
I also mean, so, you know, there's a list of government employees where people love them based upon the ideals that they associate them with. So, you know, veterans, of course, firemen, police until recently, and teachers, right? And of course, healthcare workers. So these are occupations where, because what they do sounds good, that, or, you know, and of course, soldiers in general, not just veterans, what they do sounds good, and so they get a lot of love just for existing. So yeah, I mean, the number of times where I've seen big signs around saying, like during the lockdown, saying, "We are so grateful to our wonderful teachers." This is a time where I'll have to say, "Look, I'm actually teaching my kids. Where's my sign?"
That's right.
No one's putting up signs saying, "Thanks, Bryan, for going and doing the job that teachers are getting paid to do, and you're not getting paid to do it, but you're doing it anyway." So yeah,
And
I
you
mean,
know
I also I have to say, like, I know some people don't like the idea of Stockholm syndrome. I'm a big fan of it. So yeah, I think that's a lot of what's going on. And people are here getting totally ripped off, and teachers are basically giving them next to nothing in exchange for large amounts of money. And yet, because teachers are usually personally likable and nice, people want it to persist. But, you know, like if your garbage man was a nice guy, but he stopped picking up your garbage because of COVID, you wouldn't keep paying him.
Right. And that's so you like to use the word you told me once they would like to rescue the word austerity. You think austerity
Yes.
is a good word, and you like defund stuff. So I think that there's a lot of talk about defunding police these days. So you're pro defunding police, pro defunding the education system, pro defunding generally, right?
Yeah. So, you know, defunding is greatly underrated, right? Or like you said, you know, just austerity. I mean, it's kind of funny because, you know, like on, you know, defunding is sort of the new positive, you know, term with a positive connotation for austerity. But again, like the idea is just what like my dad was like in the 80s. So you go and say, "Hey, Dad, can I have $20?" First question, what do you need it for? And then it's like, well, and what happened to the last $20 I gave you? Right? And like, what can I expect to see for my money? Right? And these are good questions for anyone that is handing out even their own money to ask. And we're handing out somebody else's money. You're handing out taxpayer money, donor money. It is a breach of fiduciary duty not to ask questions like this. Right? If you are running a charity and you don't ask hard questions like, well, what do you need the money for? What happened to the last money I gave you? What have you accomplished? What, like, you know, how will I know whether this is working? You aren't doing your job. And I say the same thing for when government officials are handing out taxpayer dollars. These are the questions that you should always be asking to find out, like, are taxpayers getting their money's worth, or are they getting ripped off? And to say, well, that's a mean question when teachers need their salaries. Like, well, like, isn't this is not charity. They're supposed to be doing a job in exchange for this money. And if they don't do their job anymore, then it's totally fair to say, well, we don't want to pay money to have people do nothing.
Yeah, that's the especially now if they're actually not even going to provide the daycare. So that's the part that's really crazy. All right, last question for you, and that's maybe a little provoking a little bit. You wrote about this wonderful idea of open borders, immigration being a completely no laws of immigration anywhere. Just people can move back and forth. And that would be amazing for the world. That would increase GDP by enormous amount. And it's hard to disagree with that notion in a sort of hypothetical level. You go through a lot of arguments supporting that and arguments against it and so on. I recommend the book highly. After a pandemic, is there any change in your thinking about immigration? Is there anything that gives you pause or give you second thoughts?
Right. So the main thing I would say is that tourism is more dangerous than I thought. Because here's the thing. for an immigrant, even a seasonal immigrant, if you were to say you have to go through a 2-week quarantine on both sides of the trip in order to do it, almost every immigrant would still say yes because there's enormous gain to them. For tourism, on the other hand, if you were to go and do that, then actually probably would greatly deter tourism. Right. So again, of course, you could try to have high-speed COVID testing or something like that, but how do you know there won't be another disease? That's hard to say. So anyway, what I'd say is that, or just to step back. So you might take a look at this and then say, see, so this is why we just shouldn't have anyone ever come to our country anymore, because we don't have a bad disease right now. The only place it's really going to come is going to be from another country. So if we just stop letting people in, then we're safe, right? And what I say, that's not really true. But you know why? Because you would also have to prevent anyone from your country from leaving and coming back. So it actually is not enough just to keep people out. You actually would have to turn your country into the old Soviet Union, where people either can't leave, or if they do leave, they're exiled, can't return. All right, now when you say, well, look, all right, that's ridiculous, then why don't we go and have testing and quarantining and so on? In which case, okay, well, fine. Maybe there's some use for that, but that is, that would be actually a very minor barrier to immigration for work purposes, which is, of course, the main reason why people want to migrate, because it is a substantial upfront cost for an enormous, overwhelming benefit. So I just don't think it would make very much difference. Again, in the end, I would still say that if there could have been some very carefully crafted limits on mobility early on, again, like if China had actually said foreigners can't leave Wuhan either, there's a 1-month quarantine, sorry, right? If they'd done that, I would have been nervous about the peace of the world, but knowing what I know now, I think that actually would have had a high chance of actually saving the rest of the world from these horrors. And of course, the amount of gratitude China would be getting for that would be less than zero, I think,
That's
at this
right.
point. Said there'd probably be a lot of people that were stuck there, and they were saying, or if you could find one American who died there because they weren't able to go and get high quality American medical treatment outside of Wuhan, then that could be an international incident, right? But still, something like that, where there's a reasonably small area where you actually can do enormous good by going and having this temporary abridgment of human freedom for a modest number of people, do something like that. To me, that's not crazy, at least. But I think what we have done is crazy, and what we're just going to continue doing, I think, is crazy.
That seems to be the case, right? Right. That seems to be the case. So what's the estimate again for if we had open borders everywhere in terms of how much richer the world would be?
Yeah. So sort of like a median estimate is something like a doubling of the production of mankind. Again, this is no reasonable person says this would happen immediately, because the way you get that large increase is by moving large populations from low productivity countries to high productivity countries. And again, it's on the order of billions of people, which is not feasible during the course of a month or a year or even 5 years. But over the course of 50 years, moving billions of people is totally feasible, right? And people say, how it can't be done? No, it can be done. In fact, China and India have had hundreds of millions of people move just within their own countries over the past few decades. So that you couldn't do this all over the surface of the earth is just wrong. It's totally realistic to think that we can move billions of people over that long period, right? And again, and like the kinds of fears that people have about moving that many people are reasonable at the duration of a month or a year. They're not reasonable at the duration of decades, where there's plenty of time to build housing and new businesses and everything else for all the people that are coming.
And, my point of making that is that I maybe I'm willing to trade off double the GDP over a period of time for even with a higher risk of a disease spreading around and killing a certain number of people, because I don't know, part of me also thinks that that's unavoidable, right? We have a and I think that if you double GDP, life expectancy is going to grow by so many other reasons. People are going to get better and live longer and so on. That if you live long enough, right, something's going to kill you, and including COVID and cancer and so on. And the point is that I think that I wouldn't give up on the immigration benefits by looking at those facts.
There are a lot of diseases that epidemiologists classify as diseases of poverty. They're basically diseases where they mostly originate and spread in places where people are poor for a wide range of reasons. So, but of course, once they originate and start spreading in an area with a lot of poor people, they can go and spread through contagion to richer areas. So I would say this is a reason to want to speed poor countries through the period of poverty to get them out of that danger zone, not only for themselves, but also so that you at least wind up reducing the risk of a lot of diseases, which one day could actually affect you.
That's right. That's right. Brian, thank you so much. And good luck.
All
Good luck with the homeschooling.
right. Yes. Yeah. So always great seeing you in face. So now more than ever.
Exactly. Bye.
Bye bye.